I'm Dr. Nirmala Lahoti, practicing neurology in East Delhi for last 15 years. I'm working in Delhi Multi-Speciality Clinic in Gagan Vihar, East Delhi, and I have a special interest in epilepsy and headache. Today I want to share my views on epilepsy, which is a very common problem. Around 50 million people are suffering with this problem worldwide, and we have around 5 million people suffering from this problem in India. Now I will be talking about epilepsy. Epilepsy is a neurological condition where a patient suffers from seizures again and again. Our brain is made up of electrical circuit. Now I will be talking about epilepsy. Epilepsy is a neurological condition where patient suffers from seizure again and again. Our brain is made up of electrical circuits, and when these circuits start working abnormally, they result in seizure, which in turn brings changes in the body movement, sensation, alteration in sensorium, behavior, and which these things cannot be controlled by the patient. Now I will be speaking on what is epilepsy. Epilepsy is a neurological condition in which patient suffers from seizures again and again. Our brain is made up of electrical circuit, and when these circuits start behaving abnormally, giving abnormal discharges, seizures are produced. In this, this produces changes in the patient's movement. It can produce abnormal sensation, change in the awareness of the surrounding, change in the behavior, and these are not under control of the patient. Now I want to explain what is seizure. Seizure is one single episode of such abnormal electrical activity. In this, the seizure, if it recurs again and again, it is known as epilepsy. But seizure may not occur more than one time in a patient, and causes of seizures may be any condition in which the brain is affected, like kidney failure, liver failure, due to excessive alcohol intake, or due to some intake of illegal drugs. It may be associated with low blood sugar, or associated with fever or trauma. Now I want to explain what is seizure. Seizure is basically one single episode of such change in electrical activity. One single episode of seizure may or may not recur. Now I want to explain what is seizure. Seizure is one single episode of such change in electrical activity. If it does not recur, we won't call them as epileptic fits. Now I want to explain what is seizure. Seizure is one single episode of such change in the electrical activity. One single episode of seizure may or may not recur. If it remains as a single episode, it is known as seizure. If we have number of such seizures, we call them epilepsy. And seizure can occur in many different conditions where the brain is affected, like kidney failure, liver failure, excess of alcohol intoxication, or may be associated with some drug intake, or may be associated with some low blood sugar levels, or at times associated with fever or head injury. We classify epilepsy into two groups, partial or generalized, and depending on the pattern of the electrical abnormality in the brain. Partial is due to involvement of brain in a small area, and in generalized, the whole of the brain is affected. A person with epilepsy can be active and normal in between the seizures. Epileptic attacks have been divided into three phases: beginning, middle, and end. Beginning is the phase where few patients can have a warning signals in the form of abnormal smell. A person with epilepsy can be active and normal in between the seizure. Epileptic attacks have been divided into three phases: beginning, middle, and end. Beginning is few patients, they may have warning signals in the beginning, which is also known as aura, and they are in the form of abnormal smell, sound, abnormal taste, blurring of vision, strange feeling, feeling of fear and panic, headache, lightheadedness, or sometimes they may feel nauseated, which lasts for few minutes to seconds. Symptoms during the middle of the seizure. In middle phase of the seizures, the patient may have sudden loss of consciousness. They may be unaware of the surroundings, may have a sudden fall. They have uprolling of eyeballs, clenching of teeth, frothing from the mouth. They may have tongue bite and drooling of saliva with jerky movements of the limbs, and at times they lose the control over urine and stool. They have labored breathing and they produce some grunting sounds from the throat. Some patients, they have seizures in the form of sudden fluttering of the eyes. They have a staring look and some abnormal lip movements and abnormal movements of the tongue and hands, which may again last for few seconds and may at times go unnoticed. Sometimes they just wander here and there aimlessly and then suddenly they become normal. During the end of seizure, patient may have loss of memory of the event, may be confused, at times they become agitated, aggressive, they may get depressed, they usually complain of headache and vomiting and generalized weakness, and sometimes they just sleep for hours after the episode. During the end of seizures, at times the patient become very confused, irritated, agitated, and they become at times violent also. They have headache, vomiting, excessive fatigue, and few patients, they just sleep off for few hours. Half of the patients do not have any cause of epilepsy, and the remaining half of the patients do not have any cause of epilepsy, and in the rest of them we can trace some of the causes. The causes of epilepsy can be divided according to the age group. In children, the most common causes are abnormal brain development, trauma in the newborn during delivery. So some of them have familial history, and at times few kinds of brain tumors also may produce seizure, and sometimes brain infection also can lead to seizures in children. In adults, head injury is very common, brain tumor, intracerebral bleed, stroke, and some of them due to positive family history. In 50% of patients, we do not find any cause of epilepsy. In rest of them, we can trace some cause for the epilepsy. The causes of epilepsy is different in different age groups. In children, the most common causes are abnormal brain development, trauma to the newborn during delivery because of lack of oxygen in the brain. Some brain infections also can cause epilepsy in children. In adults, head injury, brain tumor, intracerebral bleed, stroke with familial epilepsy. These are the few common causes of epilepsy in adults. In adults, head injury, bleeding in brain, stroke, infections, brain tumors are the common causes. What triggers epilepsy? Most important trigger factor in epilepsy in those who are already on medicine is missing the dose, which is very, very important. Stress, lack of sleep, menstruation in females, illness with or without fever, and heavy use of alcohols and drugs can also trigger epilepsy. In children, certain drugs are to be avoided and certain vaccinations are to be avoided. If those are given unknowingly, they may also trigger epilepsy. We all should know what triggers epilepsy. In patients, those who are already on medicine, missing the dose is very, very important cause of triggering an epilepsy. So we should be very, very regular in taking our medication. On missing a single dose, we should know what triggers epilepsy. The most important cause is missing the dose in patients who are already on treatment. Stress, lack of sleep, menstruation, illness with or without fever, and heavy use of alcohol and other drugs are the important trigger factors. Now, how to diagnose epilepsy? A good clinical history given by the witness is very, very important and plays a major role in diagnosing. We do go for certain blood tests and certain investigations like CT scan of the brain and MRI, which gives us information regarding the structural abnormality, and EEG, which gives us information regarding the abnormal activity of the brain. Epilepsy is a treatable condition, and these days we have many new drugs which are according to the age. Epilepsy can be managed very easily these days. We have many new drugs and which are having lesser side effects, and they are more effective. We have drugs for each age group, for females, for elderly people, for pregnant ladies, and so that they can have a happy life and they can manage.
दोबारा करेंगे मैम सारी देख ली चालू करूँ.
Managing epilepsy is very easy these days. Lots of new drugs have been added to our basket with more efficacy and lesser side effects, and affordable also. We have drugs for newborns, children, adults, pregnant females and elderly people also. Treatment of epilepsy should be taken under supervision of your doctor. It has to be continued for a long duration. One should not change the doses or discontinue the treatment on their own, and one should regularly go for a periodic checkup. 80% of patients, they become symptom free after taking the full course of treatment. Few may have recurrence after discontinuing the treatment. Here are a few tips for the general public to how to handle seizures. One should not panic, should not crowd around the patient. We should not try to stop the jerking, or do not insert anything in the mouth of the patient, or do not pour any liquid in the patient's mouth. What we can do is, if the patient is standing or sitting, we can make him lie down to avoid any fall and injuries. We should to prevent from injuries, we should remove any sharp objects around him and loosen the belt and necktie. Since the seizure, what we should do is, if the patient is standing or sitting, we should make the patient lie down so that he doesn't fall and injure himself. We should remove any sharp objects around him, and since this is a self-limiting condition, we should leave the patient alone, and after the seizure stops, we should put him on the side so that whatever saliva or secretions collected in the mouth drains away. We should loosen his clothes, and once the patient is settled, we should contact the relative or take him to the nearby medical center. Here are some tips for the patient who are already on medication. Patients should be very regular on their medication. They should maintain a seizure diary and note down the date of seizure in case there is any recurrence. This will help the doctor modifying the treatment. One should keep an iCard with the name of the drugs they are on, and also some important few contact numbers to be used during emergency.